In this lesson, we'll begin our discussion of the systemic circulatory system. We'll take a look at the arteries and veins of certain parts of the body. Before we look at specific regions, let's take a look at a major blood vessel that emerges from the left ventricle of the heart. This is known as the aorta, right? The aorta is going to be the main blood vessel that's just going to feed all the other blood vessels, which are going to supply blood to all the tissues of the body. So the first part of the aorta that emerges from the left ventricle is known as the ascending aorta. It comes out of the left ventricle. As it goes up, it's actually going to curve to the left, forming an arch. So right about here where my cursor is, this is where the heart would be. All right, so the ascending aorta right here comes out of the heart. Now it curves to the left like that. This is known as the arch of the aorta, and then we'll see it goes down. This is going to be known as the descending aorta. For this lesson, we're going to just talk about the ascending aorta and the arch of the aorta. In subsequent lessons, we'll definitely take a look at the descending aorta. Now, there are two blood vessels that I'd like you to know. We've actually talked about them before when we studied the heart, that give rise that come off of the ascending aorta. Those are the left and the right coronary arteries, right? The only blood vessels that come off the ascending aorta are the coronary arteries. And if you recall from the heart lesson, those blood vessels supply the myocardium of the heart, right? They're going to keep the heart pumping, basically. Now, off of the arch of the aorta or the aortic arch, we have three major blood vessels that I'd like you to know. The one that's located most to the right is going to be the brachiocephalic trunk. We know from a previous lesson, right, trunk means it's going to split. The second branch is the left common carotid artery. So I'm going to introduce this. Whenever we see common, it's also going to split, right, probably into an external blood vessel and to an internal blood vessel. And I'll go over that in a minute. And then the most left blood vessel, the one that's located most to the left, is the left subclavian artery, right? So brachiocephalic trunk will be the first one, left common carotid, left subclavian. Let's take a look. All right, so here's our arch of the aorta right over here. Right, so the branch, the first one coming off, right, this is on the right side. This is the patient's right side over here, right? Here's the left. So this is going to be the brachiocephalic trunk right there, and that's number one. The second blood vessel coming up right here is the left common carotid, and then the third blood vessel, left subclavian. Now, let's follow this brachiocephalic trunk for a moment. This brachiocephalic trunk is going to split. One blood vessel here is the right subclavian artery, and then the other blood vessel coming off the brachiocephalic trunk is the right common carotid. So if you look, even though things didn't come off symmetrically here, eventually everything is symmetrical. We end up with a right subclavian, left subclavian, right common carotid, left common carotid. Let's dissect this word brachiocephalic for a minute. Brachio means arm, cephalic means head. So this trunk gives rise to one blood vessel that goes into the arm, right? We're going to see the subclavian artery is a major feed into the arm, and the common carotid here is a major feed to the head, hence the name brachiocephalic, right? Brachio, arm, cephalic, head. All right, so now again, we have two subclavians, two common carotids. Okay, so those are the three branches that I'd like you to know. And again, just know as a general rule, these three branches are bringing blood to the head. That would include the brain, the neck, the shoulders, and then again, both upper limbs. A nice simple picture. So now that we know the ascending aorta and the arch of the aorta, let's take a look at the major blood vessels that are going into the head and the neck. So let's take a look at these two common carotid arteries, right? I'll read this first and then we'll go to the picture. So the common carotid arteries, they're going to ascend on either side of our voice box, the larynx. At about the level of the fourth cervical vertebrae, the common carotid arteries split into an internal carotid artery and an external carotid artery. Let's take a look at that. Come down this picture here. So here was our common carotid on the right. Here's our common carotid on the left. Notice, again, about the fourth cervical vertebrae, there's a little bit of a split, right? This is probably going to be the external carotid artery. This one in here is going to be the internal carotid, external carotid, right? So that's all I'm saying, right? That they split at the level of C4. Let's take a look at now the external carotid artery. All right, so once this splits, this is going to pretty much stay on the outside, kind of supplying the neck, the structures inside the neck, like the esophagus, the pharynx, which is the throat, the larynx, which is the voice box. It's going to go to the lower jaw and the structures of the face, right? It's kind of doing everything but the brain. And this external carotid artery has many branches, right? You'll see there's something called the superficial temporal, the maxillary artery, posterior auricular. You may guess where that's going. The occipital artery, you can guess where that's going. The facial artery and the lingual artery, you can probably guess where that's going also. So let's take a look at what I'm talking about here. Let's jump ahead for a minute. This is one of my favorite pictures. So we can see here, this is an individual. We're looking at them from the right hand side. They're kind of tilting the head back a little bit and probably to the left so that we're able to see into the neck. Here is the brachiocephalic trunk, right? That was the first branch off of the aorta. Off the arch of the aorta, I should say. And we said that it's going to split into a subclavian artery right here and a common carotid artery right here. And then we said about the level of C4, the carotid artery, the common carotid, is going to split. Right, one branch is going to be the internal carotid. We'll do that in a minute. Right now we're talking about the external carotid, and you can see here, guys, that it's remaining external. So some of the major arteries right here that I want you to know, this is the superficial temporal, kind of going to the side of the head. Right, then there's a branch here, just kind of going through the TMJ area. Right, this is the mandibular fossa right here, or the mandibular notch, I should say, kind of going this way. This is going to be the maxillary. Then this one back here, going to the back of the head. This one's nice and easy, occipital. This little guy right here, this is the posterior auricular. How do I know that? This is where the ear canal is, right? This is the external acoustic meatus. So this is kind of going behind the ear. So this is the posterior auricular. The facial is an easy one to identify. It goes right over the mandible like this. Here's the facial. And then here, this would go to the underside or inside the mandible. This is going to go to the tongue. Here is the lingual. Okay, so those are the major branches of the external carotid artery. The second branch off of the common carotid artery was the internal carotid artery. I'm going to introduce it now on this lesson, but I'll do a separate lesson on the brain, how the blood gets to the brain. This is one of the major feeds of blood to the brain. Right, so it supplies the brain as well as the eyes, right? So there's going to be a branch off of this going to the eyes, the frontal lobe, which is brain, right? Parietal lobes, and the midbrain. So it turns out there's three branches. The branch that's going to go to the eyes is the ophthalmic branch. The one that's probably going to go to the frontal lobe is the anterior cerebral artery. And then the one that's going to go to the parietal lobes as well as the midbrain is the middle cerebral artery. We're going to look at these in great detail on the next lesson. So I just want you to kind of be aware of them now. Let's take a look. All right, so just going back here, brachiocephalic trunk, right subclavian here. We'll take a look at that in another lesson. Right common carotid right here. At the level of C4, it splits. This is the external carotid and all of its branches. Here is the internal carotid artery. We could follow this up, and if you remember from A&P1, the internal carotid artery was going to go through a blood vessel, through a hole known as the carotid canal. So this is going heading up to the carotid canal. And we'll see there's going to be, and I'll do this in another lesson, there's going to be branches off this internal carotid artery which go to the eye. That would be the ophthalmic, and then the anterior cerebral, as well as the middle cerebral. But we could see it here in the neck pretty easy. Okay, let's go back a moment. So the second major artery, besides the common carotid artery that's in the neck, is going to be the vertebral artery. So let's go back to this picture here. Right. So here was your right common carotid, left common carotid. Right. We just did that, and we looked at their branches. Just coming off the subclavian, a little bit lateral. Here's one. I only labeled it on this side. Here's the other one. These are known as the vertebral arteries. These also ascend, right? They go up through the neck, and they're going to be another major blood supply into the brain. So we'll look at those blood vessels again on a subsequent lesson. Okay, so the vertebral arteries, these arise from both the left and the right subclavian arteries. Again, I just want to reiterate that. Here's the right subclavian, here's the left subclavian, and here's your left vertebral, here's your right vertebral. Okay, so they're coming off of the, not the brachiocephalic trunk or anywhere else, or the aorta, they're coming off the subclavians. Now, if you remember from A&P1, the cervical vertebrae in their transverse processes had a hole in it. That hole was called the transverse foramen. These vertebral arteries actually ascend, they go up through the transverse foramen. Once they get up to the top of the neck, they kind of converge together, and then they enter the cranial vault through the foramen magnum. And again, I'll show you that in a subsequent lesson. So let's go to the more detailed picture. Again, I'm going to do this on purpose. Brachiocephalic trunk that splits into the right subclavian, right common carotid. At C4, right common carotid splits into the external carotid, and then you see all of its branches, and then the internal carotid, which goes in to feed the brain. And that's what we've done so far. Here's the vertebral artery, and then you can look. I love this picture. These are the transverse processes that have a hole in it, known as the transverse foramen. And you can see the vertebral artery just going right through the transverse processes all the way up. And once we get to the atlas, it goes backwards to the foramen magnums right about here, and then it enters the cranial cavity or the cranial vault. Right, so that's an important artery. Okay, let's make sure we got everything. All right, so the big hole is the foramen magnum that the vertebral arteries enter. So those are the arteries that are bringing blood up towards the head and the brain. Let's take a look at some of the veins that bring the blood down from the neck, the head, and the brain. So the first blood vessel, we actually studied this when we looked at the heart, is the superior vena cava. So let's take a look how they're formed. Let's read this, and then I'll show you the picture. Again, the pictures are a little bit easier to understand. The two subclavian veins, right, these are going to be veins that are draining the upper limbs, are going to be joined by the internal jugular vein. So once these two subclavian veins meet an internal jugular vein, they are now going to form the brachiocephalic vein. Right, we're going to see there's one brachiocephalic vein on the left, and then there's another brachiocephalic vein on the right. These two brachiocephalic veins are then going to combine to form this big vein that enters the right atrium, known as the superior vena cava. All right, so it sounds confusing, but watch this. Let's go to a less confusing picture. So check this out right here. Let's take the right side. So this right here is going to be the right subclavian vein that's draining the arm, the upper limb. This is going to be the internal jugular vein, right? This is coming down through the neck. This is actually draining blood from the brain. So watch this, guys. This internal jugular here is going to meet the subclavian here to form this blood vessel right here. This is your right brachiocephalic. Again, watch this. Brachiocephalic. Brachio means it's coming from the arm, so that's this blood vessel. Cephalic means this blood vessel is coming from the head, right? Hence the name. But you got to say brachiocephalic vein, not brachiocephalic trunk. That was an artery that we just did. On the left side, subclavian vein, internal jugular vein. They unite to form the brachiocephalic vein, excuse me, on the left hand side. So one of the things I always look for, whether I'm doing dissection or whether I'm looking at a model, look at the brachiocephalic vein on the right and the brachiocephalic vein on the left. They unite and it almost forms like a V or the letter Y to form the superior vena cava right here. It kind of just reminds me like of a peace sign or the letter V. Kind of look for that. That'll always help you out as far as identifying the blood vessels. You'll also notice that the left brachiocephalic is going to be a little bit longer, a little bit more oblique compared to the right brachiocephalic, which is short, and it kind of runs more straight up and down. Okay, so let's see if these sentences make a little bit more sense now. All right, so the two subclavian veins, right, one from the right and one to the left, they're going to meet the internal jugular veins. Those veins are coming down through the neck from the brain. Once the subclavian and the internal jugular combine, they form the brachiocephalic veins. There's going to be two, one brachiocephalic on the left, one brachiocephalic on the right. They unite to form the superior vena cava. All right, so they're going to join together to form the superior vena cava. And again, it's going to look like a peace sign when you look at it straight on anterior. Right brachiocephalic vein, left brachiocephalic vein. They unite. Here's your superior vena cava. All right, here it is on this picture here. So this is the same as the artery picture I showed you, but this is just showing the veins. So here's your internal jugular vein. Right, we're going to follow this later. This is coming from the brain. It's actually coming in here from the brain. So all this big vessel here, internal jugular vein, that's going to meet the subclavian vein here on the right. Right, once this one meets this one, now we have our brachiocephalic vein. Then this is going to meet the left brachiocephalic vein, right? The right brachiocephalic vein meets the left one. And again, see that kind of peace sign right there, the V? Now we know here we have our superior vena cava. Okay. So what these internal jugular veins are actually draining are these big veins inside the brain known as the dural sinuses, right? They are large veins. They drain blood, from the brain, and then that blood goes into the internal jugular vein. So let me show you where they are. So these are kind of watermarked in there showing you that they're inside the brain, but there are sinuses known as the superior sagittal sinus. There's an inferior sagittal sinus. There's a, that would be right here. There's a straight sinus. There's a transverse sinus. All these big sinuses, occipital sinuses, are draining the inside of the brain and cerebrospinal fluid. And then ultimately all these sinuses unite to form this one right here called the sigmoid sinus. That sigmoid sinus is now going to become the internal jugular vein. If you remember from A&P1, this hole right here was a kidney bean shaped hole called the jugular foramen. And that jugular foramen is where the sigmoid sinus gives rise to the internal jugular vein, right? So all of these big vessels here, they are sinuses known as dural sinuses, and they are again large veins that drain blood from the brain, and ultimately they become the internal jugular vein. And that's my next statement here. The venous sinuses of the brain all drain ultimately into the sigmoid sinuses. The sigmoid sinus leaves through the jugular foramen to become the internal jugular vein. One of the veins from the face, the facial vein, which I'll show you in a couple minutes right here, is this is an external vein. You would think it would go into the external jugular vein. This is kind of an exception to the rule. This facial vein does drain into the internal jugular vein. I'm not overly concerned with that. It's just kind of a variation of what one would expect. Okay. All right, so dural sinuses, what you should be walking away with right now are these large veins that collect blood from inside the brain and even cerebrospinal fluid. They are going to ultimately all come together to form the sigmoid sinus. The sigmoid sinus goes to the jugular foramen, and now that blood vessel becomes the internal jugular vein. Right, go back over here again. Here's the sigmoid sinus. You can see it's receiving all these other sinuses. Now this becomes this blue vein right over here. This is the internal jugular. Now, just a couple of other veins that are running through the neck. Remember before we had the vertebral arteries, they ascended up through the transverse foramen of the cervical vertebrae. Well, in the same hole are the vertebral veins that are running down through the transverse foramen. They're going to be right next to the vertebral arteries. If we go back to this picture here, so remember before we saw the vertebral artery going up this way? Here's your vertebral vein coming down. Right, so those are going to be right next to each other in these holes. Right, so the vertebral veins, they run in the transverse foramen, if you just want to put here, right next to the vertebral arteries, and they're basically draining blood from the posterior part of the skull and even part of the cervical spinal cord. As these veins go down, they're going to contribute to the brachiocephalic veins, right? They're going to ultimately drain into the brachiocephalic veins, and I'll show you what I mean by that right here. So here's your vertebral veins. They go down, and you can see they're going into the brachiocephalic vein, which is right over here. Right? This is the internal jugular. Here's the subclavian vein. They had formed the brachiocephalic, so this vertebral vein is just jumping into right over here. That's all we're saying. Okay. The other veins that are going down through the neck are the external jugular veins. These are going to receive veins that are more superficial. So watch this, guys. I'll show you this here. This blood vessel here is the external jugular vein. This is going to receive from kind of superficial veins. Here's this the temporal vein right over here. Here's the occipital vein right over here. This is the posterior auricular vein, okay, the maxillary vein. They are all receiving or going into, their blood is going into the external jugular vein. So this is receiving blood vessels that are more external, where the internal jugular vein was predominantly receiving from the area of the brain, which is more internal, right? The only exception is this facial vein, which I mentioned before. You would think this would go into the external jugular because this is a more superficial type of vein, but it doesn't. It happens to go into the internal jugular. So the go backwards. The external jugular veins are going to receive the temporal veins, the occipital veins, the maxillary veins. All of these veins are draining into the external jugular. And then you see this external jugular right here kind of dumping into the brachiocephalic vein also. Okay, this is just another picture showing us some of the sinuses. Here's the superior sagittal sinus. This would be inside the skull. The inferior sagittal sinus, the straight sinus. Here's that sigmoid sinus that I was mentioning. So these are just some of those sinuses that ultimately drain into the internal jugular vein. Okay, so that concludes this lesson. Again, just to recap what we did, we went over the ascending aorta, the arch of the aorta and its branches. Then we took a look at specifically the blood vessels that were in the neck going up into the head. We saw the two common carotids. We saw the internal carotid, the external carotid, and all of its branches. And then we took a look at the veins, excuse me, the jugular veins and the vertebral veins.